Hi everybody. So I made this brochure to tell you about ionizing radiation, what it is, where it is from, and to tell you about the potential health risk and other health related concerns that it holds. Ionizing radiation is a form of energy that acts by removing electrons from atoms and molecules from materials that include air, water, and living tissue. Ionizing radiation can easily pass through the body tissue, and it is located on the right side of the electromagnetic spectrum. Ionizing radiation has enough energy to cause DNA damage and cancer. Radiation falls into two different categories: natural radiation, which comes from the sun, the earth, and our bodies, and man-made radiation, which comes from nuclear power plants, tobacco, X-rays, and electronics, to name a few. Ionizing radiation that comes from natural sources is typically at low levels. Our main exposure to ionizing radiation is in man-made sources through the use of diagnostic medical exams. A common example of ionizing radiation is found in X-rays. X-rays penetrate our body and reveal pictures of our bones. X-rays are ionizing because they have the capability to remove electrons from atoms and molecules and the matter through which they pass. When an X-ray beam ionizes an atom, it can be responsible for biological changes in that cell and can cause potential harm to that organism. For this reason, each exposure presents a potential risk to the individual being exposed. You can also receive ionizing radiation from CAT scans, PET scans, fluoroscopy, and other nuclear medical procedures. Being exposed to any amount of ionizing radiation presents the possibility to cause damage to cells or tissue. However, the risk of getting cancer from small amounts of radiation exposure is small. Radiation injuries are split into two categories: acute radiation injury, which occurs in response to large doses of radiation delivered over relatively short periods of time. Symptoms of this include arrhythmia or skin reddening, epilation or hair loss, nausea, diarrhea, sterility, organ atrophy, tissue fibrosis, or even death. The other category is late radiation injury, which occurs at lower doses than acute radiation injury and involves a patient being exposed to radiation over a longer period of time. Symptoms of this include cancer and hereditary effects. It is our goal as students to learn how to properly handle and administer radiation to our patients while protecting ourselves as well. By receiving the appropriate level of education and training, we are already doing our part to help lower the amount of unnecessary radiation procedures and understanding how to deliver radiation to patients at the lowest possible doses while maintaining image quality. Above are some ways we can help to lower radiation doses throughout our clinical facility. Here are my references. Thank you.